Good afternoon. Today I have laryngitis, but I brought with me Dr. Chen, who is an internist here at Kaiser Permanente, and he also does perioperative medicine, and he's very knowledgeable about the flu vaccine. So he's going to tell us everything we need to know about the flu vaccine and flu season. Let's have some fun. Thank you, Dr. Chen, for being here. I appreciate you coming on to do the interview to answer all of our questions.
Thank you, Dr. Beaber, for the introduction. And I love the opportunity to be able to go ahead and share my experience with my patients about the flu vaccination. Flus unnecessarily kill a lot of people every year. But most people who are at risk of developing complications from the flu are patients that you wouldn't otherwise take notice. Mostly your grandparents, people with chronic illnesses, neurological conditions such as Parkinson's, neuromuscular disorders, particularly with Dr. Beaber's expertise. However, from my practice, a lot of the times it's diabetes, chronic illnesses like chronic kidney disease, hypertension, history of strokes. Those things are those patients are the most vulnerable to succumb to complications of the flu. And so that's the reason why I'm so adamant, and many of the physicians are very adamant about the flu vaccination, because prevention is of the essence. And none of the patients that I ever see in the hospital ever said to me that, hey, Dr. Chen, next week or next month, I'm going to go into the hospital anticipating that I'm going to contract the flu and have complications, and I'm going to take 4 days off just to be in the hospital. So unfortunately, a lot of the times patients don't want the flu vaccine because they want to postpone it. They have their reasons, but as a physician, I see illnesses, and I don't believe that we should wait until illnesses come. I believe we should prevent. That's the reason why I'm here with Dr. Beaber.
And so a lot of people think of the flu as sort of a mild illness, take a few days off and rest, but we see it as quite a serious thing. Can you talk a little bit about that? Why is the flu season such a big deal? Why do we take it so seriously?
Yes, the majority of the people who don't realize that they may have had the flu is because they probably didn't. Colds, people often have colds where they have congestion, sore throats, and they think they've had the flu already. The truth of the matter is the flu, with influenza B, influenza A, and their various subtypes, the problem with the flu is that you're talking myalgias, chronic or serious pain where you can't move, high fevers for several days with body aches. Usually can last up to a week or two, but during that period of time, patients who are older succumb with other opportunistic infections or super infections, usually bacteria. So people make the mistake of thinking that they had the flu when in reality they had a bad cold. So the importance of it is that people do feel like, oh, they had a cold, and then they extrapolate that as the flu, and that's not the truth.
So the flu can be quite serious, and for people who aren't so familiar with the concept and vaccination in general, can you kind of explain like what is the flu vaccine, how does it work, what is the mechanism?
Okay. So the mechanism of how the flu vaccine works is this. So I'm going to go ahead, and since we know that the World Health Organization understands that exercise is the main thing to keeping healthy and longevity. So I'm going to go ahead and use that analogy. The flu vaccine and other vaccines basically is having your immune system going to the gym. So the vaccine, what it does is it is not a virus itself. What it is components of the virus that is supposed to stimulate your immune system to get you to recognize the fact that you may be under attack. And what will happen is that your immune system going to the gym will work out and develop antibodies and immunity to be able to protect you in case you do develop or you're exposed to the actual virus. That's how the vaccines work. Well, how does it protect you, and why is it that many healthy people get the vaccine and feel like they're having a cold? The reason is because if you went to the gym and worked out for 4 hours, wouldn't you be sore? Wouldn't you have muscle aches? Wouldn't you have fatigue? Well, why would it be any different if you get the vaccine and we're having your immune system go to the gym for a workout? So I think it's very important that people recognize that the vaccine, that's how the vaccine basically works. And so therefore, understanding how the vaccine works, now you know what the potential side effects are. And when I say side effects, they're really not side effects, they're expected effects.
And, a lot of people get concerned that they can get the flu from the vaccine. Is that a possibility?
So the misperception of that, there is some fallacy to it. And I want to explain to you why, because as far as we are concerned in the United States and here, if the flu vaccine gave you the flu, do you think that we as physicians will be introducing it and recommending it? The answer is no. So when people get the vaccine during the flu season and you're already at high risk, if you contract the flu, maybe within a week or two after the vaccine, that's because of a seasonal variation. No, the answer is an adamant no. The flu vaccine does not cause flu. Secondarily, if the flu vaccine, people think, well, why am I getting the vaccine when it doesn't prevent the flu? Well, no vaccine can prevent conditions, except what they do is the flu vaccine is designed so that if you are exposed to the flu, your immune system is ready to attack it. So you may have manifestations of a very bad cold rather than the full-blown symptoms. It decreases the duration and the severity of symptoms to the point where your immune system is able to tackle it and it prevents other bacterial infections or other complications.
And for multiple sclerosis, we do have very good data that the flu vaccine doesn't cause multiple sclerosis. People who get the flu vaccine don't have higher risk of multiple sclerosis. We have very good epidemiologic data on that. And, but there are certain situations where people should not take the vaccine. Is that true? When would you recommend people not get the flu vaccine?
When patients are under, for instance, when patients are under immunosuppressives and under chemotherapy, we suggest that you actually ask the professional or the professional you're seeing that are undergoing that active treatment. Certain immunosuppressives not only make the vaccine less effective, but there may be some complications. So, but the thing is it's always good to talk to your medical professional to say, listen, is it appropriate for me to get it? And when is it appropriate for me to get it?
And I should add to that, generally speaking, with multiple sclerosis disease-modifying therapies, they're not strong enough that we wouldn't recommend the vaccine, although there is some evidence with certain medications such as rituximab, ocrelizumab, that the vaccine may be a little bit less effective because you don't generate as much of an antibody response. But generally speaking, we want our patients to get the vaccine, especially if they're on immunosuppressants, because we're concerned about them, just like you're worried about people with diabetes or heart failure. We're worried about people who are on immunosuppressives because they may be more likely to get a bad case of the flu or secondary pneumonia.
Exactly. And the reason why is that Dr. Beaber and I are here to share with you some general information about the vaccines. But for those of you, as a disclaimer, for those of you that are under the care of a specialist, for instance, renal transplant patients, organ transplant patients, chronic immunosuppressives, chemotherapy for other more serious illnesses, infectious disease conditions, those things, when you have questions, please do address those issues with your specialty provider. They're more than eager to share with you, and they're all like us, Dr. Beaber and myself. We want what's the best for you, and prevention is the best way to health.
And I should add that in 2013, I was young, healthy, training for a marathon, and I got a very serious case of the flu before I got a chance to get the flu vaccine in the first week of flu season, and I was hospitalized for 6 days in the ICU. So truly, no one is immune to the flu.
Absolutely. And my motto and our motto is that nobody is ever too healthy, nobody ever is too wealthy, and nobody's ever too happy. Get your necessary vaccines and do the right thing for you.
Thank you very much for coming on to the show, Dr. Chen. I really appreciate it.
Dr. Beaber, thank you for the opportunity.
And if anyone has questions, please post in the comments below. And if there are any questions I can't answer, I'll consult with Dr. Chen and respond to you.
And for those of you that may question our enthusiasm, these are the tags that demonstrate that I have gotten my flu vaccine sometimes
and
twice.
I've gotten them as well. So Dr.
Right
Chen has gotten them longer than me because he's been with Kaiser longer than me.
Thank you.
And by the way, one thing I should mention is that we look like we're about the same height, but I'm actually standing on a treadmill desk. So it's really evened out the height quite a bit between us. Just a little tidbit there in case you didn't notice that.
No worries.
Take it easy.
And thank you and Happy New Year.